Day 4, so 96 hours after surgery. I'm just going to show you how I clean my incision line. I've already taken a shower for the evening, so typically if I were going to clean the incision line, I would have a mixture of hydrogen peroxide and water in here, 50-50, and I would take a 4x4, dip it in, and I would hold it on the incision line. As you can see, I've been trying to keep them very clean. The incisions go in the hairline, into the top of the ear, down along the fold of the ear, behind the tragus, and they disappear here into the fold of the ear, go back up behind the ear, into the hairline, and down into the bottom of the hairline. Since I have short hair, it's easy to see. So I take extra care to hold the 4x4 on with the solution just to encourage the scabs to come off. So I've already done that for today. And then the last step before I bandage back up with my sling is I use the bacitracin, or you can use Aquaphor, whichever you prefer. Some people are sensitive to antibiotic ointment and never ever use Neosporin on facial wounds. So I take my Q-tip and I get it nice and gunky and I roll it along the incision line, and I'll show you here. I roll it along the incision line, that way I don't snag an incision on the cotton swab. And I go behind the ear, being careful not to snag anything as I go. It's really not that heinous, and it does not hurt. You do have some numbness there in the incision line as things heal. So be careful brushing your hair, be careful with a hairdryer. Be careful if anything, if you're using a curling iron, which you probably won't be, but just be very careful because you're going to be a little numb in that area. You can see how tight and swollen it is, and my swelling is asymmetrical, totally normal. That will settle out as things continue to heal. So we'll check in tomorrow and see how things are going. Have a good night.